All right, let's get right into it. We're talking about oral cancer today, and the goal here is simple: to arm you with the information you need to be proactive. Because with this disease, what you know, well, it can make all the difference. So let me ask you something right off the bat. Could a routine checkup, a simple trip to the dentist, actually save your life? It might sound dramatic, but when we're talking about oral cancer, the answer is a resounding yes. And we're about to break down exactly why. Okay, so what is oral cancer exactly? Well, in simple terms, it's when cells in your mouth or the areas right around it start growing out of control. You've got to think of your mouth as a whole neighborhood, right? It's not just one spot. It can affect your lips, your tongue, your cheeks, your gums, pretty much the whole area. That's why being aware of everything that's going on in there is so crucial. And as we're about to see, catching it early is the single most important thing.
First up, let's get into the practical stuff, what you actually need to be looking for.
Now, the one word that ties all these symptoms together is persistence. Look, we all get a canker sore now and then, or bite our cheek. That's normal. But the real red flag, the thing you have to pay attention to, is when something just sticks around. A sore, a weird lump, a red or white patch. If it doesn't heal or go away after 2 weeks, that's your cue. That's your body telling you, hey, this isn't normal. And that's when it's time to see a professional. Let's be crystal clear here. The number one biggest risk factor, it's tobacco, period. And it doesn't matter how you use it. Cigarettes, cigars, pipes, chewing tobacco, it all sends your risk level way, way up. And right behind tobacco is another major player, heavy alcohol consumption. But here's the really critical part. These two risks don't just add up. They're like a tag team. They actually work together to multiply the danger. So if you smoke and drink heavily, your risk isn't just A plus B. It's more like A times B. It's a whole different ballgame. But you know, the story doesn't end there. The whole picture of who gets oral cancer is actually changing. And a huge reason for that is the human papillomavirus, or HPV. This is a big deal, because it means we're seeing more and more cases in people who don't fit the old stereotype. We're talking younger folks, non-smokers, people who don't drink much. It's a real game changer in understanding this disease.
So we've got the big three, but there are a few other things to keep on your radar. Are you over 40? That's a factor. Spend a lot of time in the sun without protecting your lips? That's another one, specifically for lip cancer. And then there are things like your diet, not getting enough fruits and veggies, or even your family history. All of these things can contribute to your overall risk.
Okay, so we've covered the risks. Now let's talk about what happens if a doctor does find something. It's all about understanding the stages of the disease, and this is going to make it super clear why finding it early is so incredibly important. Think of this progression like a fire. In the very early stages, like stage 0 or 1, it's a tiny spark in one spot. It's contained, it's localized. And that's when it's easiest to put out, right? Treatment is way more straightforward and successful. But as you move up through the stages, that fire starts to spread. First to nearby areas, like the lymph nodes in your neck. And then, in stage 4, it can travel to distant parts of your body. And obviously, the more it spreads, the harder it is to fight.
Okay, enough about the problem. Let's talk solutions. This next part is all about taking back control. We'll look at treatments, but even more importantly, what you can do to help prevent this in the first place.
So if treatment is needed, doctors have a whole toolbox of options. What they use really depends on the cancer stage and where it is. Surgery to just cut the tumor out is a very common first step. After that, they might use things like radiation or chemotherapy to clean up any cells that might have been left behind. And there are even newer, smarter treatments like targeted therapy, which are designed to go after the cancer cells more directly.
Now let's look at this number, 65%. That's the overall 5-year survival rate. And that number might not sound super encouraging at first, but here's what you absolutely have to know. That is not the whole story, not even close, because that number can be changed and changed dramatically.
And this is how. It all comes down to timing. If oral cancer is caught in the early stages, when it's still small and hasn't spread, that survival rate skyrockets to over 85%. Think about that difference. It's massive. And it all boils down to one simple thing: early detection. If you take away nothing else today, remember that. This is great because it just lays it all out so clearly. On one side, you have the things that increase your risk. On the other side, the things you can do to fight back. And just look at how direct that connection is. For every major risk factor, there's a protective action you can take. These aren't just vague, be healthy tips. They are specific, targeted ways to lower your risk.
Okay, so let's bring it all home. We've talked about risks, symptoms, and treatments. But what is the single most powerful tool you have? What's your number one best defense?
It's actually pretty simple. There's no magic pill. It's you. It's you paying attention to your own body, combined with regular trips to your dentist. Your dentist is your first line of defense. They're trained to spot the tiny, early signs that you might miss.
So what does paying attention actually mean? It means taking action. Remember that 2-week rule? If you have a sore that's still there after 2 weeks, or you feel a lump that wasn't there before, or notice any weird numbness, just make the call. Don't put it off. Don't wait and see. Pick up the phone.
And I'll leave you with this final thought. Every time you go to the dentist, they're looking for way more than just cavities. Part of a real checkup is screening for exactly this kind of stuff. So, your dentist is looking out for you. The only question is, between those visits, are you?